On Doctor's Diary, meet one face that is common in the medical fraternity. Well, and behind some of the most recent health sector revolutions, Dr. Ouma Oluga.
Nothing will change until you go on the street and protest.
There are events that shape narratives, change policies, and some shake the world. Behind these events, there are people with families, emotions, and hope.
I work for the Nairobi Metropolitan Services. I am the Director for Health Services in Nairobi. I studied medicine at Moi University. I joined Moi University in January of 2005, 10th January actually. And I graduated 10th December 2010 after 6 years of intense studies. And I think it's been very fulfilling. I say that's where I honed most of my skills. It was a very good school because it gave me a lot of opportunities in life.
While some may argue that leaders are made, some are born. Oluga's journey in leadership began way back, and he says championing for people's welfare has always been a part of him.
While at Moi University, I was the student leader for the medical students. I was the chairman of the Medical Students Association. I also became the president of the Medical Students Association of Kenya, Msake, which in fact I'm the longest serving. I served for 2 years. 2009 and 2010. I was also the vice president of the International Federation of Medical Students Association. That's the whole world. So while at Moi University, I also got an opportunity to do a lot of things while in medical school. Participated in a lot of programs, traveled the world then. I traveled a total of 15 to 17 countries, I think. While still as a student, organized a lot of activities. For example, we organized the 3rd scientific conference here in the whole country, where we had a lot of participants from a number of countries in the world, from Canada, Netherlands, Nigeria, and I was still a student then.
For a young man with a vision, nothing is impossible.
The World AIDS Day of 2009, I managed to be the one that was organizing it, and I really want to appreciate the then Ministry of Health PS, that was Professor Kiapi, and also Dr. Muraguri, who was head of NASCOP then, before he became Director of Medical Services and then PS, because they entrusted me to do it. And we organized a very huge event, the whole country, because of course I was representing students. So I've always been in this journey of trying to do things that are public-oriented, and trying to put in a lot of effort. So that's mainly about medical school. But I still managed to study. I was also among by grace of God, among the best students in the university. So that earned me a scholarship. I studied under a scholarship called the Mwangaza Scholarship, which was sponsored by Indiana University, and they paid my school fee for much of the university.
His humble beginning did not define who he will become later in life, and so he took every opportunity to forge forward, hoping to make a difference in his life and mother's someday.
Lost my dad a long time ago. My mom was unable to pay for the school fee. So high school, university, I've always studied under scholarships and support. And so the Indiana University Mwangaza Scholarship came in handy for me. I think first year and second year were very difficult. So many days I could go without food. And in the university it can be very tough sometimes if you come from backgrounds where you cannot even afford your own upkeep. But from the second year, when I applied and I got to be selected as one of the beneficiaries, they used to give us a stipend. They also used to buy for me all the books that I needed in medical school. And that really was was something. But also I was one of the students that also benefited from the overseas electives. So in 5th year of our medical school, they select the best 16 students to go to North America to go and experience the healthcare system in North America. So I was one of those students. And I spent 2 months in Portland, Oregon, in the United States of America, where I was attached to one of the best hospitals in the world, that is the Providence hospitals. In fact, some of the books that have been written in medical school by David Gilbert, the infectious diseases, the Sanford Guides, the book that doctors read a lot called Harrison's Principles of Medicine. Some of the editors, Jerry Bloomfield, those were some of my teachers, on the other side, and I've still kept in touch with them. These are people that I got to meet while I was in medical school because of this exposure, because of these electives.
It's not always about books and work with no play.
To play badminton. I was part of the Moi University team. I used to play Scrabble. Also, I was part of the national team for Scrabble. I've not played Scrabble for a long time, but I used to play Scrabble. I remember in one of our last engagements, we were meeting with the Barclays and Stanchart teams then. I was also a staunch member of the Christian Union. I was the leader of the Brothers Fellowship for 6 years in Moi University. And I was also a member of the choir. Yeah, so I could sing quite well.
After medical school, the next automatic stage will be a year-long internship, which he did at AIC Kijabe Hospital.
Kijabe is a very, very busy hospital. And for me, I thank them because they taught me compassion, they taught me discipline, they taught me hard work. Of course, already I had the traits of, I pushed myself and to go get, but it was very busy. And unlike all my other colleagues who joined internship later, we were only very few of us, only 8 of us, that did not have an opportunity between graduation and starting work, because it was just about 3 weeks. So you come from a very intense program in medical school to another very intense program in the hospital. Kijabe is an extremely busy hospital. So it was more of baptism by fire, and you report on the 3rd. I remember it was a Monday, and on that same day I was on call in the night. And for me, when you're in medical school, there's the choice that you make in terms of the internship centers that people want to go to. So they do something called balloting. I think medical students are familiar with this. But for me, I didn't have the chance to ballot because I just chose Kijabe straight away. And I applied. I wrote a very passionate letter to them, which they accepted. And it was good for me because also having experienced a bit of the American medical system, Kijabe also has a lot of mission doctors who are from America, North America to be specific. And so it was also something I wanted to continue with in terms of that mentorship, and also especially the culture of compassion, discipline, hard work.
After taking a short break, he was posted to Vihiga County, where he developed interest in cardiology due to cases of non-communicable diseases that he came across.
I was very fond with the community because the western part of Kenya had a lot of people who, especially people who suffer non-communicable disease, diabetes and hypertension, and those clinics had never been set up. So I did set up those clinics then. Also did quite a lot of work in terms of teaching, including working with a few corporates to just look at lifestyle diseases. We did a lot of medical camps then, together with the Diabetic Management Institute. Then that's the time I started interacting with senior colleagues like Dr. Njenga, who is now the chair of the Medical Council. So by the way, my history, I come from a very long history of already working with very senior colleagues from very far. And then 2014, I left Vihiga, came to Kenyatta National Hospital, where I joined my master's for internal medicine. But between 2012 and 2014, while also at Vihiga, I was also doing another program of infectious diseases institute at Makerere University, where I also had a postgraduate diploma from Makerere. We would go there. During that time, there was the Ebola outbreak, and then there was an outbreak of Marburg virus in Uganda. And together with a team that was supporting Makerere University called USAMRI, that's the United States the Army for Research and Development, they were teaching us, a number of colleagues then.
Tunapeana sasa strike notice ile tunaita ya labor according to the labor laws for 7 days.
In 2017, when yet again the doctors' plight became a national conversation, the Kenya Medical Practitioners, Pharmacist and Dentist Union (KMPDU) became more popular, one of the lead faces being Oluga's. Despite being thrown in jail, Oluga and his colleagues were still adamant to bring change. 100 days plus, and doctors vowed not to set foot in hospitals until their pleas were heard.
When I came to Nairobi, and that's the first time actually I was like now living in Nairobi, I noted that a number of doctors were having a lot of issues, you know. And at that particular time, there were a lot of challenges to get from internship to postgraduate studies to, you know, just a lot of issues. And I felt, I think I can do something. I think the work that I've done for doctors also speaks for itself, you know, improving, you know, the package for doctors by more than 311%. That's quite something. So we, you know, the work we did in the union, and of course with the doctors, made some of the best unions in Africa. And you know, it was it wasn't meant just for the doctors, and I think I have to say this because I've said this before. It was meant to make sure that people can be retained. You know, when we were in medical school, there's this conference that we organized. I was the chairman of students then. I was the president of all medical students in Kenya, and the then cabinet minister was Professor Anyang' Nyong'o. So we invited him to Eldoret, and we invited a number of students and a lot of other doctors. And you know, that time, 7 out of 8 doctors that were graduating were resigning from government. And what it meant is that every single hospital that you went to, there were no doctors. You know, so there was a lot of inadequate access to doctors by members of the public. So all these doctors were either resigning to work for NGOs that were paying better, or they were going to the private sector, or they were leaving the country. 7 out of 8. If you look at the statistics, in 2007, there were only 700 doctors working for the public sector. In fact, there was a cabinet memo that was done by the then head of public service, Ambassador Mudaura, that was looking at a critical workforce that needs to be, you know, protected. But then, you know, these efforts, there was no investments. In fact, WHO that year also classified Kenya as one of the critical countries with severe shortages, you know. And so when we were graduating in 2010, nearly the whole of our class, also many people had decided that they were going to quit. In fact, the first thing that we were discussing is that we were not going to join internship. So that because government hospitals, public hospitals, depended so much on interns as a workforce.
Asked about moments from his jail cell, he recounts life-changing moments that have stayed with him till date.
I was in Committee Maximum Prison, and yeah, I had my good experiences there. I went there, everyone was telling me about their stories of healthcare in terms of the need. Some of them, you see, you know, the first day I was taken there, I went to the dispensary. Yeah, and when I went to the dispensary, first, because I had some headache, and when I went to the dispensary, The following day, I just woke up and started doing a ward round. And, you know, some of these inmates or the prisoners, you find they have been there for long. They have been neglected. They've never been attended to. Some of them are sick. They need advice. And for a moment, I also forgot about the fact that I was a prisoner. And I just started, you know, and there was a big line. In fact, I spent that whole day just, you know, writing for them prescriptions, trying to review what medicines they have in that dispensary. And by the way, I can tell you now, in the position that I am in, that we've also tried to really improve the healthcare of prisoners. In fact, we are expanding the medical center at Community Maximum Prison. We've invested, and because of some of the things that I saw when I was there.
Just like a house needs a pillar, he has had quite a number of people playing a key role in his life. People he would say can look after him.
My mom comes to mind. She's been really quite a key pillar every step of the way, you know, supporting us even when there was nothing. As I mentioned, we 7 of us in the family. I am right there in the middle, and our education was quite dramatic. You know, growing up in the village, no food, no nothing. I mean, the odds were quite against getting to this stage. But when you get, my mom prays a lot, and therefore she's also very supportive. There are also a number of senior colleagues who've really held my hand. I think every step of the way, for me, I've had favor. I've had favor with my teachers. Primary school, I had a lot of favor with my teachers, you know. They would understand even when you missed school because of 1 or 2 reasons, but they would also support me and encourage me. You know, I've had favor with my teachers in high school. By the way, the board of Maranda paid my school fee when I couldn't afford. So my mom paid for 2 years, and then when I was in the 3rd year, it's called what, Form 3, yes, it just ran out. And instead of being sent out of school, the then principal, Mr. Osiemo, and the school board, together with the church, then they just decided they will take over my school fee. So, and that's why I'm also very indebted to Maranda. That's where I was. And so as you can see, I've always been a product of good deeds by people who are not known to me, by people who would otherwise have abandoned me. And so the board of the school actually paid my school fee for those 2 years. And therefore I was able to study. And in return, of course, I also support a lot of students in that school, a lot of students, nearly 35 of them, you know. And most of them are people I also do not know, but they are people who are struggling. And I do this out of, you know, just the fact that if someone doesn't do it, no one will do it.
Away from work, he is a dedicated husband and a father to his 2-year-old son.
Oh.
When I'm not a doctor, I am a father. When I'm not a doctor, I am a husband. When I'm not a doctor, I play. Yeah, I try to get time to read. I read a lot, actually. Sometime before, I used to try, taking good walks. I like nature. I travel also, you know. I like to just go out and see the wild, you know, just the mountains and, you know, taking very good walks.
He, however, wants his son to follow his own path and chart his own way.
I think what is very important is that whatever he wants, number one, he should be very passionate about it. Number two, it should be of a lot of impact to the society. And number three is that it should be of, benefit to himself. So, you know, there's usually the balance between passion versus benefit, and many career coaches advise people, you know, do things that you're passionate about, but sometimes things that you're passionate about do not pay. Yeah, and sometimes things that you are passionate about are not of benefit to the society. So you must have the triad of the three, that you must be passionate about it must be able to pay you, and it must, or at least to support your life, and it must be able to be of benefit to the society. The society is, you know, the whole spectrum of humanity will always have problems, a lot of problems. Right now we have political problems, healthcare problems, you know, legal problems, everything. So we need human beings who are trying to solve problems for other human beings, who are trying to make life better.
Now in a different space, he says there is not much change. He is still a doctor and will always be.
I sometimes joke that I haven't noticed the difference because, you know, the problems that we have are the same. It's just the approach is different. So what I had access to in KMPD is very different from what I have access to now. So now I may make one or two policies, I may put, you know, a word, I may try and do some budgeting, you know. Then I had the advocacy and I had the doctors, you know. So the tools and the framework are different. So when you are in a union, the framework that exists is the labor relations, is the constitution. So you follow that law then. And there is nothing that I did that I can regret, absolutely none. And even now, there is nothing that I have done. In fact, I think I have solved more problems now than I ever did in the union. I think so, because we've also created a lot of opportunities. We've been part of an amazing journey. I think you've seen the president's agenda for Nairobi, and together with the Director General, the expansion of the 24 hospitals, which I have been coordinating and I've been running in the field. And on the first day when I was given that assignment, I've gone to every single informal settlement trying to choose the location for the hospitals to be built, you know. These things we've done there. And for me, it makes me very proud. In fact, one of the things I am very proud working for NMS is that it proves that civil service can work. And I love public sector, and I want public sector to work. And then, so when you're in an environment where civil service works, it's very encouraging. The strike is hereby called off.
With all the achievements so far, Dr. Ouma Oluga says he is not done. He is just getting started. Sada Hassan for Doctor's Diary, KTN News.